The Gauteng Department of Health wants increased police visibility in and around the Rahima Moosa Mother and Child Hospital. Now, this comes after several incidents of crime were reported in the vicinity of the hospital. In the first incident on Christmas Day, a nurse was hijacked at gunpoint after leaving the hospital. The second incident was reported on 27 January when the two people were shot during another hijacking at the hospital gate. Motalatale Modiba is Gauteng Health spokesperson and joins us now. Motalatale, very good evening and thank you so much for joining us.
Thank you very much for having us.
Let's start right there. I mean, this is quite worrisome that a place like a hospital would see so many incidents of crime. Do we have an idea what is at the heart of these incidents of crime that are happening too regularly?
I think if you're familiar with the area where Rahima Moosa Mother and Child Hospital is located, you would know that we are in the Coronation Ville. That area on its own, if you look at the surrounding areas as well, it's an area that is prone to the type of incidents that we actually currently experiencing. So because the hospital is not an island in itself, it's actually located within communities. So it will obviously be affected by the social issues that are emerging within that particular community. So generally, there is a crime problem in the particular community where the hospital is located. There are other social issues that are emerging there. And obviously, at the moment, we are feeling an impact in terms of some of the incidents that happen, especially with community patients that are coming to the facility to receive services, or our own staff members. Because remember that for you to get to the hospital, you have to travel through the very same communities that are currently experiencing challenges. So I think it's a symptom of some of the challenges that require society, that require law enforcement agencies and all other sectors to work jointly to ensure that we read those particular communities, your Westbury, your Coronation Ville and surrounding areas of the persisting crime challenges there.
Now, with that said, I guess that's where the call comes in to say, how then do you solve such a problem? Because I'm sure it discourages not only patients to come through to Rahima Moosa, but also the health workers that work at the establishment.
Of course, it is a concern because, I mean, as you rightly said, we had one of our colleagues who was hijacked just shortly after leaving the facility, and there is an incident that we saw as well happening where you could tell that the criminals were probably targeting the particular vehicle as it was coming into the facility. So I think we have been able to engage with the various stakeholders within the area, especially the security cluster, where your SAPS, your JMPD, your CPF, and other structures within the community met to look at various ways in which the situation could be tackled. From our side, obviously, as the health department, we are exploring other measures in terms of beefing up and increasing of security, but that will only apply when you are inside the facility. There's still a concern of when you are outside the facility, and part of the engagement there is it's a request that has been made to SAPS in the area in South to say, look, can we be able to have a situation where there's a mobile unit outside of the hospital or within the vicinity of the hospital to be able to increase that level of visibility, not only for our staff, but also for the public and the patients that are coming through. With STPF as well, they've committed to also ensuring that there's greater patrols within the area. We're also talking to some of the security companies within the area that provide security services there in terms of ensuring that maybe if there could be an increased visibility in the area. But I think the most important thing is for the community to be able to come together and for us to work collectively, because these incidents are not committed by people that are not necessarily within the community. It's something that requires the rest of society to come together, hence the call that we've made. But not only that, there is, I know that some of the initiatives that have been planned that I think in the coming months, the communities they have are trying to put together a program that will raise awareness in terms of having a peace march, and just to really raise concern and mobilize other sectors to join in ensuring that we create safer communities where we are.
Normally, Motalatale, what sort of security does an institution or establishment like this have? Is it just normal security that one you'd find at the gates? Just to clarify, what sort of security under normal circumstances is provided at a place like Rahima Moosa Hospital?
Look, across all our facilities, we've got security companies that have been contracted to provide security services, not just at the gate, but across various points within the health facilities. And what we've been doing now lately is also to beef up the technological use in terms of CCTV cameras and so forth. And I think even this current incident that happened has been caught on CCTV, and the police have that particular footage in terms of being able to try and identify the suspect in this particular incident. But we've got your security companies that are tasked with the services of ensuring that we safeguard our health facilities. But you'd recall, Kwena, that health facilities are your public spaces that should actually be easy to access, because usually we're providing care to communities who are in need of emergency medical care and so forth. But obviously, given the current circumstances, we are now also being forced to start beefing up and considering other security measures, which maybe some of them I would not necessarily talk about here, but I know that there's a number of measures that are being considered insofar as beefing up security. But that would not necessarily solve the problem, because this crime is not something that is within the health facility, something that comes from outside to inside. So it means if we're going to address the problem, we would need to address it societally and address it outside, because if outside is safer, you might be secured inside the health facility, but what happens when that nurse, that doctor leaves for the night shift and they have to go home, or they have to come to work for their night shift? How do we ensure that they are secured when they're coming from wherever destination they're coming into the health facility? I think that's the part that requires the security cluster to obviously come in and look at other measures, but also the call that we're also making is to the community itself, because if the community is not going to take a stand and also stand with us on this, it's ultimately going to impact on the services that have to be received by the very same communities that need the services. So we're saying a crime does not happen in isolation. It happens within a particular context, within a particular community, and therefore the best way of resolving and solving it is to work closely with communities and community structures. But it's also for the community members to also take a stand and say, this crime cannot be happening in our communities. So we will report incidents. We will ensure that we cooperate with law enforcement agencies. Fortunately, in this recent incident, the vehicle was recovered in a few hours. The CPS were able to react, but the suspects still need to be apprehended so that they can be brought to book. And I'm sure in the community, somewhere, somehow, people might be knowing who these people are, and we're dealing with them to say, let them come forth and report this incident, even if they report it anonymously to the law enforcement agencies, for them to be able to act on this.
So what is the call now, particularly to the police? Because if we are talking about security within the hospital itself being different, and these crimes happening outside the premises, clearly that is a matter that should be handed over or be dealt with by the police, SAPS, as it were. What are those conversations like, and is there any promise or positivity coming out of those conversations?
We are in engagement with the security cluster. Like I said, obviously cases have already been opened with the Sophiatown police station in terms of the two incidents that you referred to earlier on. But outside of those cases, there are ongoing engagements with the security cluster, which involves not only SAPS but also other state agencies for them to obviously look at other mitigating factors in terms of strategies to actually combat the high crime levels within the particular area, ensure that crime is actually brought down and eliminated eventually. So we have been engaging with the security cluster. We have raised the concerns that we are currently having. We have made a call or a request that they consider increasing patrolling around the hospital, but also a police mobile unit in the vicinity of the hospital as well, so that we can see if that would not actually assist in terms of clamping down on these criminal activities.
Motalatale Modiba, thank you very much for coming through to speak to us. We appreciate your time. Motalatale Modiba is Gauteng Health spokesperson.